I'm a person who can't sit still. So when my orthopedic surgeon told me, you're gonna need a total knee replacement, I was fearful. My mindset was that it was gonna be difficult, but I was going to do the work. I am so thankful for JOURNAVX. It's difficult to put in words. About 2 or 3 days after my surgery, I wasn't able to tolerate the prescription opioids, so I was advised by my doctor to stop taking them. And because of my medical history, I wasn't going to be able to take the NSAIDs. The mentality they want you to have is that you need to move right away. But if you're experiencing so much pain, it's just not possible. I want to have my range of motion back, but at the same time, I couldn't do it. My first thought is, I just went through this huge surgery and it was for nothing. I remember I had a 2-week appointment with my orthopedic surgeon, and 2 weeks doesn't seem like a long time, but when you're in constant pain, it felt like a lifetime. I asked my doctor, there has to be another option, and that's when I first heard about JOURNAVX, a non-opioid for moderate to severe acute pain.
Good girl.
I remember right at about the 2-hour mark after the first dose, saying, the pain is starting to go away.
Do not take JOURNAVX if you take certain medicines that are strong inhibitors of an enzyme called CYP3A. Ask your healthcare provider if you are not sure. Please keep watching for full important safety information.
I started to get into physical therapy, bend my knee, and put in the work. I'm happy with my progression. I'm hoping to get back to a lot of the activities I once did, like playing pickleball. I'm hiking, not as far as I used to, but I'm hoping to get there soon. It's a continuous journey. I'm happy that I'm on my way.
What is JOURNAVX? JOURNAVX is a prescription medicine used to treat adults with moderate to severe short-term acute pain. It is not known if JOURNAVX is safe and effective in children. Important safety information. Do not take JOURNAVX if you take certain medicines that are strong inhibitors of an enzyme called CYP3A. Ask your healthcare provider if you are not sure. Before taking JOURNAVX, tell your healthcare provider about all of your medical conditions, including if you have liver problems. People with liver problems may have an increased risk of getting side effects. Are pregnant or plan to become pregnant? JOURNAVX may temporarily reduce the chance of females becoming pregnant while on treatment. Are breastfeeding or planning to breastfeed? Tell your healthcare provider about all the medicines you take, including prescription and over-the-counter medicines, vitamins, and herbal supplements. Taking JOURNAVX with certain other medicines may affect the way JOURNAVX and the other medicines work and may increase your risk of side effects. Ask your healthcare provider or pharmacist for a list of these medicines if you are not sure. Especially tell your healthcare provider if you take hormonal birth control medicine, contraceptives containing progestins other than levonorgestrel or norethindrone, as they may not work as well during treatment with JOURNAVX. Use non-hormonal contraceptives such as condoms or other forms of hormonal birth control during treatment and for 28 days after you stop taking JOURNAVX. Medicines that are substrates of the CYP3A enzyme, as they may become less effective during treatment with JOURNAVX. Your healthcare provider may need to adjust the dose of your medicine when starting or stopping JOURNAVX. What should I avoid while taking JOURNAVX? Do not take food or drink containing grapefruit during treatment with JOURNAVX. What are the possible side effects of JOURNAVX? The most common side effects for patients treated with JOURNAVX included itching, muscle spasms, increased blood level of creatine phosphokinase, and rash. Tell your healthcare provider if you have any side effect that bothers you or that does not go away. These are not all of the possible side effects of JOURNAVX. Call your healthcare provider for medical advice about side effects. You may report side effects to the FDA at 1-800-FDA-1088. Please see full prescribing information, including patient information, at journavx.com.